Hello again, this is Dr. Beth Colby. Now, if you are depressed and everything's very much an effort, I know that these 10 things may appear overwhelming. Don't worry about that. Just choose one or two that you can focus on and go with them. Then in time, as you feel better, you can work on some of the other things. Okay, the first one is be kind to yourself. This is easier said than done when you're feeling low. When people are depressed, they feel dreadful about themselves. They may think they're a bad person and their self-esteem goes down. However, if you are beating yourself up, being nasty to yourself, please think about how you would treat a friend who was feeling as you do, and then talk to yourself in that nice, kind way as well. This is the time for you to take time out and concentrate on your own health and take care of yourself. This is not selfish. If you had a physical health problem, like you've broken your leg or in hospital with a heart attack or had chronic asthma, diabetes, you'd have to look after yourself. Physical illnesses are no different to mental illnesses. They are both illnesses. So don't feel guilty about having to take time out from your normal responsibilities and focus on yourself for a change. Being kind to yourself and looking after yourself may be doing things that you enjoy doing, that you find relaxing. Take time watching a film that you may enjoy, even though you may not be able to concentrate so much. A feel-good film, that is. Spend time looking at a magazine or reading something that's light that you can manage. Listen to music you like, and to ask for help from friends or family if you have them. People may be able to help with chores that you normally would have to do, like shopping, cooking, your housework, or babysitting, just to give you a break from your usual responsibilities so that you can take time to heal. Pace yourself, be kind to yourself, be patient. If you have negative thoughts, try and challenge these. Are they based in reality? What would you say to a friend who says they had these thoughts? What can you do to distract yourself from these thoughts? Is there another way you could look at the situation you find yourself in? The second hint or tip is talking to somebody you trust. People find that talking to somebody else often eases their feelings of low mood. People have told me that just coming in to see me and having a listening ear has really helped them, and they say they feel better even though I appear to have done nothing in the consultation. Some of your friends will be able to listen to you, others will be able to just take your mind off things and do something different. It's important not to withdraw from life. Friends and family will make you feel less isolated and alone. If you feel there's nobody you can talk to, the Samaritans are very good at listening. Their service is not just for people who have thoughts of self-harm and suicide. They also give a listening ear to anybody who would like to talk to them, and this is in confidence. So please feel free to do this if you need to. Number 3, have a healthy diet. I know that some people, when they're depressed, go off their food, they have no appetite, they eat less and may lose weight. This won't help their mental health. So if you feel like that, please make sure that you have a balanced diet and eat 3 meals a day, even if you don't feel as though you can or don't want to. If you feel as though it's too much to make a meal, have some easy food, but well-balanced meals. Make sure you have fresh fruit and vegetables. And if anybody can give you meals, or you can buy pre-prepared meals that are healthy, do that. Don't be hard on yourself that you're not able to cope with cooking at the moment. Important to get out of the house, to get fresh air, to see other people, even if you're not interacting with them, to get a bit of exercise, to see nature. All these things will give you temporary respite from how low you're feeling and your thoughts, feelings, and a motivation or energy to go out. If you feel that's the case, perhaps a friend could take you out, and that will give you the motivation to get up and dressed, for instance. Don't just socialise with friends who are really good at listening to you. Also keep in touch with friends who may be able to just take your mind off how you're feeling. Feel up to going out, but if you do, at the end of the day you'll feel as though that you've achieved something, and the temporary respite will boost your mood. Number 7 is keep up your routine. I know when people are depressed, they may not be able to go to work or carry on the same responsibilities that they normally have. If this is you, don't worry, but you can do something about your routine. If you go to bed at this normal time, get up at the normal time, this will help your mental health. Try not to stay up late and sleep in too much. Try and get dressed and washed at your normal times, and have 3 meals a day at the normal times, and have your snacks and cups of tea or drinks when you normally would. All these things help break up your day, and you won't feel as though the whole day's interminable, that you've got hours and hours of nothing to do and feeling dreadful. At the end of the day, you'll look back and think, well, at least I got out of bed, I ate, little things that will make you feel as though you've actually achieved something. Try and set a small task for yourself each day. That again will help you feel better about yourself, that you've achieved something, even if it's something small. If you can't, please don't feel guilty or bad about yourself. Remember, be kind to yourself. You will do it eventually when you feel a bit better. And you can try it again when you're feeling a bit better. Take care of your hygiene. This will make you feel better about yourself. Having a shower will relax you. Putting on clean clothes and makeup, or the things that you normally would wear, will make you feel better about yourself, rather than staying in your pyjamas and not looking your best. Number 8 is write things down. Some people find it helpful to write down their thoughts and feelings in a form of a journal, perhaps. It's one way of expressing themselves, and later on they may be able to look back and see how far they've come. If this is for you, do that. You may find it helpful. Other people find it helpful to have a sort of planner or a weekly timetable, perhaps writing in a diary or a calendar of things to look forward to, just like somebody coming around and having a cup of tea, or going out and having a little walk. These things will have you something to look forward to on your calendar. Again, you can look back and see that you've done something and feel as though you've had a sense of achievement. Set yourself little goals and don't focus on things that you won't be able to do. Write your meal times down in your bed so that it helps you remember that if your memory's not too brilliant because you can't focus very much. If you feel as though there are problems in your life and these may have caused your depression or add to what you're going, you may be able to change some of them you might not be able to, but write down what things you could do to start changing different situations that you might be in. Caffeine, alcohol, tobacco, cannabis and other recreational drugs. In the short term, it may make you feel as though you're less anxious or take your mind off your problems or give you extra energy, but in the longer term, it will decrease your mood and make you feel more depressed. Don't drown your sorrows with alcohol. Alcohol is a depressant. If you drink lots of caffeine, you may feel as though you're getting more energy, but actually it will affect your sleep negatively, getting off to sleep, and also you may feel more anxious and agitated. So try and cut down on the amount of caffeine you're having, such as in tea, coffee, fizzy drinks, still drinks, flavoured drinks, perhaps altering your caffeinated coffee or tea with decaffeinated coffee or tea. And certainly don't drink caffeine after 6 o'clock because this will affect how you get off to sleep. Don't try and take your mind off your problems by using recreational drugs or tobacco, increasing your cigarette consumption. All of these can be addictive. You'll need more and more of these to help you feel a bit better, and certainly won't help your depression nor solve any of your problems. Also, if you feel as though you're trying to maintain your mental health and feel better about yourself by gambling or other addictions, please try and seek help from other organisations about that. Alcohol Anonymous and Gamblers Anonymous, and your practice nurse for tobacco use can be of help in your addiction to these. Yes, it may appear that it helps you to relax. It's been shown that this can cause depression. Please keep hopeful. Unhelpful thoughts, try and challenge. Remember, speak to yourself how you would to a friend. Things will get better. 1 in 4 people experience depression, and people do get better. Try and hang on to that and be patient with yourself. Remind yourself again that other people do have depression. People get better. Depression, when you come out of it, you may actually be stronger than you were before. And it also may make you make helpful changes in your life. So that's the 10th one. I know, as I said at the beginning, these may seem overwhelming. Don't beat yourself up about it. Be kind to yourself and do some of these things to start with, even if it's one, and things will improve. If you find that your situation is far more desperate than that you're extremely depressed and not getting any better, you have suicidal thoughts or thoughts of self-harm, think you're better off dead, please seek medical attention urgently. You can call 111. If it's an emergency, call 999. You could attend your local accident and emergency, get an emergency appointment with your general practitioner, or phone the Samaritans. There is help out there. You will get better. In summary, the 10 things you can do to help yourself if your mood is low or if you want to keep yourself mentally healthy are as follows. The first is be kind to yourself. The second is talk to somebody you trust. The third is eat healthily. The fourth is get a good sleep routine. The fifth is exercise. The sixth is get out of the house. The seventh is keep to a routine. Is write things down. The ninth is avoid tobacco, alcohol, recreational drugs. And the 10th is keep hopeful.